Well, good afternoon, and thank you very much for joining us. This is a public meeting, and the purpose of the meeting is to discuss your care, your views. It's about redesigning our sites and our services. And in this session, we are going to share with you some of the feedback that we've had. A few things, I'm sure if you've joined our sessions, you'll be familiar with the rules of engagement. So we do ask that your microphone remains off. Your camera will be off, please, to help us with bandwidth. And we ask that you use the chat function, sending questions to West Herts Communications, and we will answer your questions at the end of the presentation. I should say that we will give preference to questions that relate to the presentation. So particularly interested in hearing from you if you have queries about any of the proposals for our services. Important for me to tell you that the session is being recorded. So I hope that's okay with you. And as I said, we will be sharing with you some of the feedback we've had during phase 1. We're now in the second phase of public engagement, and we will be sharing with you information that you have given us. And we know that there is some concern or curiosity about our plans to move particular services. So we are going to really put that out nice and clearly today. So we will talk about which services are moving and which are staying. We will tell you how you can get involved and to share your views with us. And as I said, there will be an opportunity to ask questions. So if you have read any of the documentation or seen any of the filmed meetings that we held in March and February, then you will understand a little bit about our aim, our vision, and that is to maintain our 3 sites, but not just maintain them, to redevelop where necessary, practically rebuild at Watford, and to really make sure that each hospital site has a very distinct role, but that all 3 hospitals work together to provide a comprehensive range of services for patients across West Herts and all the other areas that we serve as well. So just to think about those 3 hospitals and the role that they will perform, Watford will be our centre for emergency and complex care and specialist care. St Albans is where we want to expand the range and the volume of planned surgical care and to have a greater focus on cancer care. And there will be an urgent care service. We know the minor injuries unit is closed on a temporary basis, but we are expecting the CCG later this year to hold a public engagement a bit like this to talk to you about the urgent care offer that will be provided from St Albans City Hospital. And Hemel Hospital will be a multi-specialty site. So it will be the site where we will see patients who have multiple conditions or long-term conditions, and we will also provide urgent care at that service. There will be some outpatient services across all sites, and diagnostics will get an uplift at all 3 sites. So feedback from your care, your views. We have on this slide the 3 things that had the highest score. So the things that people who responded to the survey or attended our meetings said were the most important to them. So having diagnostics built into appointments, which sometimes we call one-stop clinics or one-stop appointments, was really important to a lot of people who filled in the survey. And we're pleased that it is, because that is very much at the core of what we want to do. We want to organise our services around the patient, putting as many different specialties together in one appointment as possible to save patients waits and delays between treatments and to make things more convenient. So we were pleased to see that your feedback is in tune with something that we want to do more of. Secondly, and we weren't surprised because this has come out at all the public meetings that we've held since we've been talking about hospital redevelopment, which is quite a number of years now, travel is really important to you. and there are concerns about parking, about public transport. So we have absolutely heard that message, and we are setting up a travel and access group. So there will actually be two groups, a steering group and a reference group, where we would like members of the public to be involved on the reference group. And interestingly, the feedback that we had was that people who live in Dacorum and St Albans were reasonably happy to travel between the hospitals in those two areas, but less happy to come to Watford, and people in Watford and Three Rivers would prefer all their treatment to be provided at their local hospital, which is Watford General. But if they do have to travel, there wasn't really much preference whether it was St Albans or Hemel Hempstead Hospital. The state of our buildings and the need for new buildings was something we also heard loud and clear, and particular criticism for the buildings at Watford. Happy to say that the standard of care overall people seemed happy with, but we know it, you know it, the buildings, particularly at Watford, really do need massive overhaul. And again, we were pleased in a way to hear that, because that is something that we are absolutely desperate to take action on, and we're very confident that we are going to have up to 90% of new buildings on the site at Watford General. In the meetings and a little bit in the survey response also was some anxiety about the move to digital models of healthcare. And we did pick up some anxiety that people are worried if that is the only way that they can be looked after. And I'm really pleased to say, and it's really important for you to know, that it's not compulsory. It's not compulsory to have your healthcare delivered like I'm talking to you. If for whatever reason you would benefit from a face-to-face or a telephone appointment rather than something that's more technologically based, then that will still be an offering to you. And yes, and that feedback did come through in the meetings and the survey. So in response, we are looking in more detail at case studies. So we are going to present to you by the end of June case studies which really tell the story from the patient's perspective about the model of care that we currently offer and the model of care that we want to offer in the future, so you can see the difference. And the changes will be about when we combine different parts of the patient's treatment in one appointment. So you will be able to see from the way we present it how things could be better and could be improved, and that patients could have a better experience. But we need to tell that story a bit more than we have done so far. Also, we want to do some targeted research to just test the responses that we've already had, because there was some differences of opinion depending on where people lived. And so we want to just do the sample again with a more representative sample. Run the survey again with a more representative sample, just as something to hold up against the results that we've already had. And that's a piece of work that's underway already. And the other piece of work that we are doing is to dig a little deeper in this issue of transport that I was explaining to you. So we are talking to patients whose service has moved or is about to move, to find out what it is that they liked about the service where it is, or misgivings they might have about the move, so that when we do make any changes, we can do so with the benefit of what we've heard from our patients. So we are continuing to broaden and deepen our networks in the community. We're working through faith groups. We're trying to cover the whole geography of where the trust provides services. And with that, we would also like to extend an invite to you to invite us to any group or society meetings that you have. And if you do want to hear a presentation, it will be this presentation, but maybe for members of the community who haven't yet heard about the changes that we propose to make, then please do get in touch. and there will be more details about that at the end of this presentation. And the bottom bullet point there is just about the travel and access steering group and reference group. And thank you, I have already had a couple of names, so thank you very much for sending us an email to say that you're happy to be involved. That's really, really good. I'm now going to hand over to Esther. Esther will introduce herself and talk about the services that are going to be provided at our 3 sites. Thank you very much.
Thank you, Louise, and thank you to everybody who's joining us this afternoon. I'm Esther Moores, and I'm working with our clinical teams on the plans for our new facilities, very much looking at the nature of the care pathways, as well as how that translates into buildings. So I'm going to talk about each of our sites, and some of you may already be familiar with some of this from previous sessions, but also thinking about how that relates to the feedback that we have received. So first of all, thinking about Hemel Hempstead Hospital. Our intention really is that Hemel is a centre of excellence for patients who have long-term and or multiple conditions, and that there's a real benefit in having a familiar, calm environment where patients can be seen and can be seen by specialists and specialists that are relevant to their care. So very much thinking about having a multi-specialty approach, so that, you know, if you need the care of the cardiologist, the respiratory team, the endocrinology team, where it's in your interest that they are comparing notes and working with you collectively, that's the model of care that we're seeking to move towards. To support that, it's really important that we have the right diagnostics available. So at the moment, where we have our complex diagnostics, some of it is historical, and this is a really good opportunity to make sure that we've got the right sort of facilities, the MRI, the CT, the DEXA scanner, to support the nature of the patients that will be cared for on the Hemel site. And then we also are really mindful that the advances in technology are helping patients to be in control of their care and to have more available right at their fingertips. For our COVID virtual hospital, we've been very much at the forefront of leading work as to how we have enabled patients to monitor their oxygen levels at home, to feed that back to our clinical teams so that they can look at how best to care for that patient, but using information that's actually readily available and that technology helps provide whilst patients are at home. And that's increasing across a range of specialties, and certainly our clinicians think that there will be much greater opportunity for that in future. Important, as Louise said earlier, of course, that where we do have technology, where we are doing things virtually, that we also have that opportunity for people for whom that's not appropriate to come into the site and to see a clinician in person. It's really important that as we go through all of this, we think about our staff. And as you can see from the bullet point that's gone up, we're looking at how technology can support them working together and providing that sort of multi-specialty team. But we're also thinking very much about our staff facilities and making sure that we have the sorts of spaces for staff to rest and recuperate that we know that as they need. And actually, with the football club very close to Watford during COVID, that's proved incredibly important. And finally, the DEXA scanner will be there at the Hemel Hempstead site, because we will have a really strong rheumatology service. They really want to increase the service that they're providing at Hemel to make sure that they are there, and we have lots of opportunity for them to compare notes with other clinicians as part of caring for patients with a range of medical conditions. So the summary on the right-hand side just gives you a flavour of the range of the services that we are expecting to be delivered on the Hemel Hempstead site. Okay, so on to St Albans. So St Albans is already our planned surgical care site, and what we are wanting to do is to really enhance our one-stop clinics, particularly for cancer diagnostic care. So at the moment we have a range of specialties on that site providing surgery. We also have cancer diagnostics, and we really want to make sure that we keep that model, because having a separate site for surgery helps protect those procedures, those appointments, and reduce the risk of cancellation for patients when they've been preparing for their operation day. Linking with services for cancer and the opportunity to have more one-stop diagnostic care for cancer, it's important that endoscopy and cystoscopy are available on the St Albans site, and this really gives the opportunity for those clinicians to work closely where needed with the surgical teams who will be available on the site, but also having access to clinical nurse specialists and making sure that if there were to be a diagnosis of cancer, that we've got support available on hand for those patients, and that we can really be a centre of excellence for that at St Albans too. The next box I think is self-explanatory about how important it is to get results back to patients quickly, and that having an MRI and a CT on the St Albans site, which we don't currently have, really supports that rapid diagnostic and that one-stop care. Another feature of having a separate site for planned operations, planned surgery, is that it really helps us minimise the risk of infection for those surgical patients by having a separate site for planned care, as opposed to having those procedures taken care of on the emergency site. So that's really important in our clinicians' thinking and our development of the plans for each of our sites. And as we are looking to improve our theatre facilities at St Albans, so we're also looking to make sure that we have expanded recovery areas so that they are improved to enable the surgical activity that we're expecting to continue at St Albans. Next slide, please. So finally, thinking about Watford, this is our emergency specialist care site, and it delivers a range of services that have to be supported by the presence of an intensive care unit and the full range of diagnostics and clinical support that's available there. So women's and children's services are really important to us. We are really looking forward to being able to improve the environment and to make sure that it's appropriate for those groups. And one of the things that we are planning is that for women giving birth at the Watford site, they will come in, they will go into a room that is theirs for the course of their labour and post-labour care whilst they're with us, wherever that is clinically appropriate, so that it can feel a more welcoming environment. For our emergency care services, we are planning to make sure that we will have a unit where we have as much of the same day emergency care services, all co-located adjacent to one another and with diagnostics readily available, and working on the principle that we really want to try to make sure that, again, our specialists move to the patients so that we can have a pathway of care for patients needing emergency assessment where they aren't moved around the hospital to the same degree that our current building really forces us to do. It's a really great opportunity. We've spent a lot of time with our clinical teams looking at all of our services and saying, if we are looking at this from scratch, what needs to be next to one another so that we can provide pathways for patients that make sense, and where we can make sure that they aren't moving across buildings in the same way as they are at the moment, and particularly our diagnostics, they're central to everything that we do. So we're really thinking about the layout of the building and how we wrap our services around each other so that we get that right. And child-friendly design, we are mindful that as we develop our children's services, that we can provide an environment that's welcoming, that feels really child-friendly, and that we're also considering young adults whose needs may be slightly different, and people with a range of requirements. One thing that the new build will help us deliver is to have many more single rooms for patients on our wards. So that really helps with privacy and dignity, of course, and also really helps to protect from the potential spread of infection. And obviously with recent experiences, that's at the forefront of our minds, and we've really thought through how, having had the experience of COVID, informs how the hospital of the future should look. And then finally, we're really aware that there's a therapeutic benefit of having green spaces, having outdoor spaces for staff and for patients. So we are also looking at where we can build that into the design for the hospital at Watford. So a little bit of a whistle-stop tour, which summarises a whole host of detailed conversations and a huge amount of time from our clinical teams in thinking through how we want to plan our services for the future. The slide here just summarises the benefits and what we really want to achieve here. So I won't repeat that, other than to say that I think the pathways for patients are at the core of this, but also very much prevalent in our thinking is knowing that the pathways make sense actually is really beneficial for our staff. They're so keen to make sure that they deliver excellent care, and this is a really good opportunity to get that right for staff as well and recognise their contribution. So the slides that follow, it's the same information cut a slightly different way. So I'm not going to dwell on each of these slides. They will come up and you'll be able to have access to them, of course, on YouTube as well. But it just gives you a sense as to what's moving in what direction. So we will just stop occasionally on this particular tour, but I won't talk through each slide in detail. So if we move on to the next slide, please. This one particularly is a little different because our fracture clinic has moved locations as a result of COVID. So I just wanted to flag this one up particularly because it's very much the thinking of our orthopaedic team that the right place for the fracture clinic in the new build is adjacent to our emergency department. At the moment, it was at Hemel, it has been at St Albans, but the intention is that it would be at Watford in the future. They've already gone quite some way in delivering care virtually for patients with a recent fracture, and we absolutely expect that that will continue too. On to the next slide, please. The key theme here really is that there are some services where we expect to deliver hubs further north within our area. So for orthopaedics and spinal surgery, their general outpatient care at St Albans will align with their surgical site there at St Albans. And for the other specialties on this slide, diabetes, rheumatology, cardiology, respiratory, we're really anticipating that their services at Hemel will expand. On to the next slide. And finally, there are 3 slides here that just talk through some services that will continue to be provided as they are at present. So I think we can just sort of scroll through these so that you can get a flavour of some of these services that will be staying put. Thank you. Over to Louise to conclude.
Thank you very much, Esther. Sorry, everyone, I'm just getting my camera up. Great, so you have the engagement timeline in front of you, so you can see sort of where we're heading at the moment, and that this meeting firmly sits in the second phase of our public engagement. We will consider the feedback that we've had so far and the feedback that we have at the end of this period of engagement that will be put into a report for our trust board and also the CCG board, and that will be considered when we are looking at the clinical brief, and also we will continue working as we are doing at the moment on our outline business case, and we expect to submit the outline business case either towards the end of this year or early next year. That is a decision for the new hospital programme, so we just keep on going, a lot of work to do on that. And the next slide, so this is important because it tells you how you can get involved. There is plenty of information on our website, and the public meetings that we held, many of them were co-hosted by clinicians, so there are sessions that are very particular either to our site or to an area of medicine or nursing, so you can really sort of delve deeper if you wish to into particular topics by looking at those meetings. Important to remind you that you can invite us to come to any meetings that you have, and also we are still asking for your feedback. It's not a survey like we had in phase 1, it's just 4 questions, but really important for us because they tell us that our engagement is working or not working. You can tell us what you are learning from it or what you think we're missing out, and share any views that you have that you haven't yet shared on our proposals. We can provide translations if you require, and we can also provide you with information to share in community groups or via newsletters, and this presentation, the slide deck, and also recordings of the same presentation that we ran earlier this week and last week are also available on our website, so all can be shared. So over to you now. I have had some questions coming in as we've been talking. Quite a lot of them I think I am going to hand over to Esther, but I will pick up one just before we go to Esther, and that was about urgent and emergency care. And there was a good question. We talk about urgent and emergency care. Good question is, what is the difference? Now, if you were in a situation where you weren't sure yourself, the best thing that you can do is to call NHS 111, and they will slot you in wherever you need to be seen. They will advise if you need to go to an A&E department. They will send an ambulance if that's what you need, or they will get you an urgent GP appointment or medical appointment if that's what you require. So we always say the first port of call is NHS 111. To give you an idea of the difference between urgent and emergency care, urgent care would be strains and sprains, suspected broken limbs, obviously not if the bone's kind of, you know, poking through the skin and you or a loved one is losing consciousness, that would be emergency, but small breaks you would expect to be treated at an urgent treatment centre or an urgent care centre. Minor head injuries, cuts, bruises, stings, anything that you think is just not really needing a blue light ambulance into an A&E department. Emergency contraception also, that would be something that an urgent care centre would support you with. Emergency are the more serious things: loss of consciousness, heavy bleeding, unstoppable bleeding, sudden acute confusion, chest problems, serious head injuries, severe allergic reactions, which are, you know, danger to life, so inhibiting breathing, stroke, car accidents. So there is a difference. The website, the NHS UK website, has these definitions, but as I say, always, if unsure, please call 111 and you will get the best information that you can, and even an ambulance sent if that's what's needed. So I have some questions that I'm going to put to Esther, and one of them relates to the percentage of buildings. So this will be a Watford General Hospital, and we say up to 90%. And so quite rightly, somebody has asked about what are the 10% of buildings. I'm not sure we quite work it like that, but Esther, could you maybe describe the breadth of the new buildings that we expect to see, how that will be split between clinical and non-clinical, and what we expect to maintain from the buildings that we already have at Watford? Thank you.
Yeah, thank you very much, Louise. And obviously, we are continuing always to look at what we're doing, because we're wanting to make sure that we get the right balance and ensure the value for money for the taxpayer. But in essence, our intention is to prioritise clinical space in new buildings. So Watford is a big site. It affords us plenty of space to replace our existing clinical buildings, our women's and children's building, our PMOK building, some of the other buildings that we are currently delivering services in. So what we are looking at when we're saying that is that it's, our ambition would be to replace our clinical services in a new building. Some support functions, administrative functions, etc., wouldn't necessarily need to be in a brand new building. We may be able to accommodate those in an existing.
Thank you, Esther. Can I carry on with another question about the Watford site, which is about the size of the estate and whether it will be reduced in any way. So I think you could probably talk about how poorly we use the estate at the moment, and the notion of going up instead of along and across. So perhaps you can touch on the reduction to the footprint at Watford General. Thank you.
Yeah, sure. So any new building would be built to new hospital standards, and therefore the actual space would be bigger than we currently have for a ward space, for a cubicle space, etc. So we are looking at having quite a tall building on the Watford site, a large building, and if you would like to see more about that, we are our plans are now available, so they can be readily found. So when it comes to then the rest of the Watford site, we're of course wanting to make sure that we keep space for expansion, so that in the future we're going to be able to add extra buildings as and when we might need to do that. So there is actually a lot of land there at Watford, so when looking at how we make sure we cover the expansion space and whether we retain all of it is something that's very much a live conversation at the moment.
Thank you, Esther. And among those live conversations, can I ask if we have yet decided about education and research, because we are in the middle of applying for teaching status. So as an organisation, we're proud of the education role that we perform. We want that recognised in our title. But is there plans to sort of see that recognised in the way that we apportion various parts of our estate?
Yep. So the new clinical facilities themselves will lend themselves better to education and training on the job. There will be more space, there will be better staff provision, there will be seminar room provision, etc. So we're really wanting to make sure that that's core to how we're thinking of our future buildings being up. When it comes to our medical education centre, which is our sort of seminar rooms and meeting rooms, which are really important to the education of our clinical staff, they're part of that cohort of services that I mentioned earlier, where we're looking at where it would best be located into the future.
Thank you. And thinking about service expansion, you have said that there would be room on the site for services to expand, but we are also expanding services. I mean, you don't always need new space for expansion, but we are looking, aren't we, at different services that we haven't traditionally provided. Are you able to talk maybe about IR or some of the inpatient neurology services that we are discussing at the moment?
Yeah, so essentially medicine never sits still, and after 20 years in the NHS, I'm always in awe of how quickly things change and how quickly our clinical teams adopt the new technologies and the new ways of working. So Louise mentioned interventional radiology, and that's very much an expanding specialty, and it's very much something that we know is going to grow and that we need to accommodate in the new hospital. So within our plans, we're making sure that we've got sufficient interventional radiology space so that that service is one that can continue to develop. We know that diagnostics generally, the demand is only seems set to increase. And we're really fortunate at Watford already in having a cardiac MRI and a cardiac CT scanner, but we know that our diagnostics service is going to grow. And as we've looked at how we set up the hospital, one thing that's been true of all departments is that they all want to be as close to diagnostics as possible. The other things that we are of course doing, thinking about how services change, is thinking about our place within the whole health system and working with partner organisations. So where we can deliver care, particularly for thinking of the Hemel site and people with long-term conditions, and how we make sure that we work sensibly with our community partners is very much part of our conversation at the moment too.
Thank you. I have a question related to the height of the buildings, which is how we can justify building high-rise buildings which limit accessibility and decrease access to fresh air and green and open space. So, I mean, I will go to Esther if she wants to add in, but it would be really great if you could hang on for a few days, and by the end of this week, all the plans will be on the Watford Borough Council website. In fact, some of the plans are already available on the BDP, that's the architect's website. All these details are on our website, and you will see, I think, an awful lot of attention has been given to green space. So although there aren't acres and acres of it, it has been thought of at almost every corner. So there is a real determination to make the setting as pleasant as it can be, notwithstanding that the primary reason for people to come is to get healthcare, and we are increasingly working to make hospital stays as short as they can possibly be. So we don't expect people to be recuperating for a long, long time in our hospitals. It is an acute hospital where people will come in and get the healthcare they need, but we still want to make it as green as possible. And high-rise buildings, and it is common for hospitals to be in high-rise buildings, will have good new functioning lifts, and so it should be easier. In fact, sometimes it's quicker to get up than it is to get along. So we think it will be accessible, highly accessible for wheelchair users and for other people with limited mobility. And we have tasked the architects with making access to green space as good as it can be. And with that in mind, the views from the tower blocks, which we call the fingers, the three fingers with the ward space in, will on the whole be very good across the Colne Valley. So we are thinking about the views that patients will have and some of the planting. More detail will be available once the plans are on the council website, or you can see more by looking on the architect's website. Did you want to add anything more to that, Esther?
No, I think you've covered it really thoroughly. The only thing I would just mention, I think there was a picture right at the start of the slide pack, and a picture definitely paints 1,000 words, and it really does bring to life what we are planning. So, I think with everybody who's taken the time to join us this evening, it's as things go up on YouTube, it would be helpful to make sure that those links will be readily available on our website, etc., so that you can see what it's looking like. Right.
Thank you. I have a question about cancer treatment, because we talk about St Albans as the site where we want to provide more cancer care, or really sort of centralise the care that we currently give. This is to avoid patients travelling and to make sure that people who need cancer surgery are just going to the same site at St Albans. But I've been asked about radiotherapy, and perhaps you could say, Esther, where radiotherapy would be provided, and if it's not St Albans, why is that? Thank you.
Okay, so radiotherapy is a very specialised treatment. So the intention isn't that it would be provided at St Albans. Obviously, you may well be aware that our nearby Mount Vernon are considering their plans into the future. So I think the intention is that it continues to be a service that's provided by Mount Vernon, and that will be provided by them on whichever site they are delivering their care into the longer term.
Thank you. I've been asked a question about the voluntary service building next to Watford General Hospital and what will happen to it. So I don't know if we have that level of detail, but I don't think it's one that I'm not sure quite which this building refers to, because we have just removed a small building that was next to the Women and Children's services, but we are planning to really move out of a lot of our buildings and re-provide somewhere for our volunteers. Our volunteers have been absolutely at the heart of our response to COVID-19, and we are very mindful that they will need a hub or a base in wherever we are going to be in our buildings. So although we don't have the exact place for them, we understand the value of our volunteers, just how much they've helped us and how important it is to have them alongside our staff. So although I can't give you an absolute answer on what will happen to the building and what space they will inhabit, I can tell you that they are really important to us, and that we will make sure that there is a volunteer hub somewhere on the Watford site. I don't know, Esther, if there are any further plans that we can share, if we've got down to that level of detail.
No, I have nothing to add, please.
Okay, so there are a few more questions about space for patients, families and carers. So that is something that we are working out, to make sure that there are areas in our patient areas, in our clinical areas, where family can be, where they can rest, or we have rooms which are specifically for breaking bad news, or talking in detail about the patient's condition, quiet spaces. That is something that we will be planning. When we get closer to having final designs, we will want some feedback from members of the public. There won't be a huge latitude in what can be dictated, because we are without huge latitude ourselves. All hospitals in the new hospital programme are following modern methods of construction. So there is a tried and tested standard which we have to work towards, and that also can dictate ward layouts and sizes of rooms, bed spaces. So there is some limitations on all hospitals, and that is to make sure that everybody reaches a really, really good standard. But it does mean that there can be limits in quite how much participation meaningful participation we can have from members of the public, because we can't always make the changes that you wish to see. I'm just being honest there. It's not that we don't want to, but we are very confident in the modern methods of construction, because they are models that have been tested out with patients, with members of the public, with families. So these are good footprints that come with the benefit of feedback already. Is there anything, Esther, you would add on spaces for family carers?
Only that I've recently come off a call with our paediatric team. It's it's absolutely core to the thinking for the paediatric areas that we will have single rooms, that we will have space for families to be with their children.
Thank you. I've been asked about the current estate, by which I'm sure the questioner means Watford, and what we will do with the estate that we are not using for healthcare, whether there'll be an emphasis on residential, commercial, or indeed football club expansion. I'm sure all of our current efforts are probably on what we want to do for the benefit of our patients, but rather than any other use of the land. But Esther, do you know if there are any discussions on land which we don't intend to use for healthcare?
So it's not something that I'm so directly involved in. I spend a lot of my time with the clinical teams. I'm not aware that there are.
Okay, thank you. I mean, from everything that I see in here, it's 100% focus on the buildings that we need for the clinical services that we provide. I've been asked a question about improved facilities for patients and staff at Watford, but what is being provided at St Albans and Hemel Hempstead. So I think Esther did talk through that in quite some detail. So I would recommend that maybe a watch back of this presentation once it's uploaded, or any of the 2 presentations that we've already done using this slide deck. Freddie Banks, one of our consultant urologists, does a talk through of the slides that Esther also talked through, and that will be online soon if it's not already, and that just gives all the detail of those 2 sites. So although we've talked about Watford, that's really in response to the questions that we've had. It is important to see our plans as being about all 3 hospitals, because the way they fit together is really important for us, and defining the role of each hospital is really important. Watford is where we see the highest number of patients and the highest number of acute patients, and where the majority of the investment will be and the majority of the building work. But that doesn't alone make it the most important. We would say that the way that the 3 hospitals work together is really, really vital to us. I've been asked about engagement with St Albans and Dacorum councils and MPs. It's very much the same as Watford. You know, we talk to the councillors at both St Albans and Dacorum, as we do with Watford. We are regular attenders at the St Albans Health and Wellbeing Partnership, and also to Health in Dacorum. So we do present regularly at those meetings, and we are also in regular conversation with our MPs. They speak often to our Deputy Chief Executive, or to our Chairman, or to our Chief Executive. So there are routine calls with all of those people, and we also have conversations with the planning leads at all 3 councils. So we've had a lot of conversation with the council in Watford, because we're just on the verge of having our planning application made public. And when we get closer to our planning applications with St Albans and Hemel Hempstead, we will increase, Dacorum, we will increase the amount of conversations we have with those councils. I've been asked a question about 24-hour kitchen facilities. I presume so, but I just don't know for sure. I don't know if that's come up in the fine detail of the planning, Esther. We do have ways in which we can find food for patients at any day, any time of the day and night. Wards always have food in their fridges for patients because, of course, they get admitted at any time. They might be coming round from procedures at any time. So I don't know if there's hot food available all through the night, but I know that food can always be found for patients or visitors if that is needed. So sorry, I can't answer that in any more detail. I'm just going to have a look through just to check of any questions that we haven't answered. There is one that I don't think we can answer, which is the finance in place for all 3 sites? That is definitely a work in progress. I mentioned at the beginning that we're working on our outline business case, which we will submit towards the end of this year. And that really sets out what it is that we think we need. And it will also have the costs in. We are having continuous dialogue with our regulators, that's NHS England, NHS Improvement, Department of Health and Social Care, Treasury, New Hospitals Programme, very lively conversations. So that work continues, and it won't be for a few months now before we have a complete answer on our finances, because we are still working up our plans. I don't think in the course of this meeting you've heard anything different, have you, Esther? Nobody's called you to say that everything's there for us? And no,
We have to make the case.
we absolutely do. So it is a process, is the best thing I could say. I have a comment about overdevelopment without being dangerous, without sufficient room for expansion. And I think on all 3 sites we are very mindful that there should be room for expansion. And don't forget that because we are changing how we are designing our buildings, there will be room on the site at Watford and a little bit also at St Albans and Hemel Hempstead. In particular, the multi-storey car park at Watford will really change how we use the space. So instead of cars covering the site, they will be in a multi-storey car park, and that will really release a lot of space. So just by being more clever about the way that we do build, because the Watford site in particular has grown up in a bit of an ad hoc style over decades, and that has really resulted in a very poor use of space. So having room for expansion is something we are very mindful of, which I think Esther has already given some assurance about. So I think I am coming to the end of questions that we haven't already covered. So unless there's any quick questions, I do actually have a comment about the Metropolitan line expansion. So, and the person who sent that in says it does reduce possible future access to Watford. So, you know, the point of the travel and access steering group is to work with local authorities, to try and involve the transport companies, to make sure that we can make the case for the best public transport that there can be, whilst also reducing the need for patients to come in to the hospital for quite as many outpatient appointments as they do now, because we will be moving a lot of outpatient appointments where clinically appropriate to online. So so we'll be looking at both moving online with treatment where we can, and also improving the public transport. I've had a new question in while we've been talking. Are we intending to sell the estate at the 3 sites? I think there are conversations about parts of the site that could be developed in other ways. Esther, have you got anything that you can add to plans for the estates at our 3 sites?
No, I mean, obviously the conversation is about what do we need to make sure that we have the future expansion space. I think there is opportunity, has been outlined in the case for land sales on our sites. but it is very much a current conversation. It's not one that there's a definitive, this is what it is.
Thank you. Yes, it's important, but it's definitely secondary to making sure that we have the buildings that we need for the clinical care that we wish to provide. So on that note, I will draw it to a close, but not before I've reminded you that there is a feedback form that you can fill in. The planning application we expect to be all there for you to look at on the Watford Borough Council website by the end of this week. I'm sure it will be picked up in the local media, and if you are a member of our stakeholder reference group, we will send you the link when we have it. So plenty more information to look out for, as well as the information that we have already provided. So that leaves me with the task of thanking Esther for joining us and thanking you also for making the time to be with us this afternoon. Thank you.
Thank you.